Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hey everyone, it's Nurse Paula. Thanks again for joining me this week. And if you know what, if you're considering any kind of laser procedure, skin typing is really important. And all clinics really should be doing this when you come in for your very first laser procedure. It doesn't matter if it's laser hair removal, laser skin surfacing, IPL photofacials, any kind of laser procedure, you should go through skin typing. So let's talk about this. In 1975, there was a Harvard dermatologist. His name is Dr. Thomas Fitzpatrick, and he developed this classification scale, and we call it the Fitzpatrick classification scale. And what it does is it classifies skin types by how easily a person will burn or tan. And it's going to take into consideration their complexion and also their tolerance to sunlight. So it's used as a benchmark in all aesthetic clinics on how a person's going to respond to laser and light. Because IPL photofacials, that's not a true laser. That's a flash lamp device. That's light. And then you have other types of devices that are lasers. And your skin needs to respond to this light energy that's coming into it. Now, here's the problem. With mixed ethnicities in people today, you know, a laser technician just can't look at a person anymore and guess how their skin's going to respond to a laser. So why is this so important? Because lasers see pigments. There's pigment in your hair. There's pigment in your skin. There's red pigment in your blood. There's pigment in tattoos. And we want to make sure that when we fire a laser, we're targeting the correct pigment. You don't want to be left with a white spot, which is called hypopigmentation, or a dark spot, which is called hyperpigmentation, or worse yet, a burn. So there's going to be a questionnaire that every patient's going to take, and we tally up this score to get their type. Some of the questions are, what's your eye color? What's the color of your natural hair? What's the color of your skin in unexposed areas? Do you have freckles on sun-exposed areas? And what happens when you lay in the sun too long? And what degree does your skin turn brown? Do you turn brown several hours after you're in the sun, or do you still stay pink and red? And when did you last expose yourself to the sun or a tanning bed? And believe it or not, even these tanning creams, they matter too, because those things are a pigment. It's a dye that goes on your skin, and the laser will see that. How often is the area that when you want to have a laser treatment performed on, how often is that exposed to the sun? So when you answer these questions, you tally up the score and you come up with scales 1 through 6. Skin type 1 is a person who's very white and fair, red with blonde hair, blue eyes, freckles, all the way up to a skin type 6, which is a very dark black skinned person who never burns and tans very easily. Now, certain things that can inhibit how a laser responds to your skin. You can go in, you can do this questionnaire, you can be honest, answer it perfectly. But if you're not telling your laser provider that you're suntanning in a suntan bed right before you came into the office for your treatment, or you have a lotion on your skin, or if you're using retinol products or certain photosensitizing medications, there's some antibiotics out there that are called photosensitizing medications. What they do is they make your skin very sensitive to light. These types of things I just mentioned can actually increase the light intensity in your skin and can even lead to a burn. So you need to be open and honest with your laser operator to avoid any unforeseen consequences. So on a previous podcast, I talked about brown spots, and I mentioned that IPLs cannot be used on darker skin types because it's not a true laser. It's a flash lamp. It can burn dark skin, and there are certain lasers that are made to be able to treat suntanned and darker type skins. Certain ethnicities have a tendency to develop a condition we call a paradoxal response, like Indian descent. And what that is they can develop an undesirable hyperpigmentation after being treated with a laser. So, you don't want to go in for laser hair removal and be left with a brown spot where you had your treatment done. So usually what we do is we recommend skin testing. We'll shave a little area maybe on the back of the neck, and we'll test with the laser to see how a person's skin is going to respond if they're questionable. So there's one last thing that I want to make a comment here. If you're getting any kind of laser procedure on your face, And if you're prone to cold sores, you need to let your provider know this, because these laser treatments around your face, this virus harbors in your tissues and it lives there, and light brings it out. And you know what? A laser is a light, and it's going to cause, or it could cause, a flare-up of your cold sores. You have to make sure you let your laser provider know beforehand if you're prone to cold sores and you're getting like laser hair removal around your mouth, your upper lip and chin, because you need to start on your medication ahead of time to prevent a flare-up of your cold sores. This is really important to remember before you get any kind of laser procedure. So that's the Skinny on Skin Typing 101. You'll find out what your number is when you go in and you meet with your first laser technician for your first laser procedure. You'll go through the Fitzpatrick skin typing chart and you'll find out if you're 1, 2, 3, 4, 5, or 6. Thanks so much. We'll see you guys next week. Make sure you subscribe to my podcast on iTunes and SoundCloud, and it's even available on our website at youngmedicalspa.com.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittinen social media creation. SteveMittenensocialmedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.